Hello, my name is Rayyan Syed, and today I will be replacing a patient's percutaneous endoscopic gastrostomy tube, or PEG tube for short. For those who are unable to swallow, a PEG tube is crucial as it allows for food and drink to directly enter a patient's stomach through a tube instead. This replacement procedure must be done if a patient's PEG tube is dislodged, malfunctioning, or obstructed by food particles. For this procedure, the following will be used: a PEG tube, similarly sized to the one already existing on the patient, a 10 milliliter Luer lock tip syringe, 60 milliliter syringes, one for gastric aspiration and the other for water flush after replacing the tube, sterile water, which is already loaded in the syringes, gauze pieces, alcohol swabs, lubricant, sterile gloves, masks, and apron, and then a sterile drape already around our patient. Wash your hands and dry them thoroughly. Wear sterilized gloves and an apron before touching the tube or stoma. The replacement PEG tube, which is similarly sized to the patient's current PEG tube, is prepared. To ensure the tube's balloon is functioning, insert the tip of the Luer syringe into the balloon port, injecting about 3 to 4 milliliters of sterile water. Inspect the filled balloon for any leaks or deformities in shape, but make sure not to touch the balloon in order to keep it sterile. Once confirmed that the tube is functional, reinsert the syringe into the balloon port to remove all the water from the balloon. Keep this new tube in a clean, sterile place. The current PEG tube in the patient's body should be examined. Observe the centimeter marking of the external retention disc on the current tube, so the replacement tube can be positioned to the same marking. The tube insertion site on the abdomen is examined for any signs of infection. The area around the insertion site should be appropriately cleaned with alcohol swabs and covered with surgical drapes to avoid contamination from the surroundings. Deflate the balloon on the current PEG tube by aspirating water through the balloon port using the Luer tip syringe. Slowly remove the current tube by applying gentle counter pressure on the abdomen. Use the gauze to wipe or absorb any gastric contents around the stoma. Before inserting the new tube, clean the skin around the stoma with alcohol swabs. Now before continuing, remove used gloves and wear a fresh pair of sterilized gloves. Lubricate the tip of the new PEG tube for easy passage into the tract. Insert the tube into the patient's abdomen. Once the tube is completely inside the abdominal tract, inflate the balloon by injecting 3 to 4 milliliters of sterile water through the balloon port using a Luer tip syringe. When the balloon has been filled with 3 to 4 milliliters of water, retract the tube until a gentle resistance is encountered from the internal balloon pressing against the inside of the gastric wall. Gently slide the external retention disc to the same setting or marking as the old tube, about 1 to 2 millimeters above the skin. To confirm the placement of the new PEG tube in the stomach, place a 60 milliliter syringe in the feeding port, using it to aspirate any yellow or clear gastric contents, the presence of which confirms the correct placement of the tube. After the gastric contents are seen in the syringe, remove the syringe from the feeding port and dispose of it properly. To complete the procedure, flush the tube through the food port with water after positioning the patient at about a 30-degree angle to check for any leakage around the stoma. Observe the patient for any complaints of pain or discomfort. Ensure the patient is put in an upright position for at least 1 hour after the tube replacement procedure. The procedure is now complete. Thank you so much for your time.